being here.
Thank you all for having me. I'll start off and I'll try to go through this fairly quickly. A lot of the content that you'll see in my presentation has pretty much been touched on by the previous speakers in the different presentations. I think I captured some of the key points that have been highlighted earlier today, but I also would like to try to add a little bit of my experience and insight that I think might add some value to you and maybe share some perspective. So I'll start with August 2011. A Marine stationed in Afghanistan who is about to be deployed on a secret mission, not knowing how the outcome of that particular mission will end up. Meanwhile, his wife is expecting their first child, and she's at home or at the hospital in Maryland, worried and wanting her husband to be a part of this experience. At that particular time, it was a situation where we were trying to figure out how can we bring these two parents, expecting parents, together to share this special moment for them before he goes off onto his mission. So we were able to use our telehealth solution, our mobile cart solution at the time, to be able to connect him through a cloud-based solution using off-the-shelf video camera technology and be able to create a secure video session to allow him to join from his bunker in Afghanistan prior to his deployment on this mission, to be able to watch and witness the delivery of his child for 8 hours. And that right there is the end result after the baby was born. You see the Marine in his bunker in Afghanistan, his wife holding their new daughter. Afterwards, the baby had to have some follow-up care and tests done the next day, and he was able to watch the examination to check on the status of his baby, on his daughter, and be assured that the daughter was receiving the care necessary, making sure that mom was recovering well. And everything from that point on was a kind of a teary-eye, emotional moment for all that was involved. We had an entire unit of nurses and various providers that were all a part of this. It took a coordinated effort from a number of different folks to make it all possible. But we were able to do this because we had some reliable technologies that were able to get the job done in the moment of need. And so that's how it started. That's one of those moments in my experience at Holy Cross Health where I made an impact on a patient and their loved ones. And it's one of those stories that I will take with me for whatever I end up doing the rest of my career in telehealth. So I wanted to start off with that because a lot of the things that we've talked about here today and a lot of the presentations that have been discussed have talked about best practices and challenges and different things to consider when you're doing your healthcare telehealth program and various initiatives and solutions that you may try to introduce into your environment. And not all of them will be a clinical outcome per se. In this particular situation, we weren't really saving someone's life or really trying to improve a clinical outcome, but what we were trying to do was bring a family together to improve the patient care experience. And in this particular case, we were able to use technology to accommodate that. And so for that, we have to look at what are your objectives, what are the things that are important to you and your organization, what are the things that you're trying to do. We hear all the buzzwords about triple aim and patient-centered care, and what does that mean? For a lot of individuals, for a lot of organizations, they really don't know what that means. They may have ideas and things that they want to do, but they don't really know until they really see how these services and how technologies can be used to improve the patient experience and provide a level of comfort to loved ones or to patients when they're receiving care or in times like that where it was a joyous occasion. So before I continue, I just wanted to give you an outline of my presentation today. I'm going to share a little bit about my professional background. I'll give you kind of a healthcare overview. Much of the information that I will provide during that portion of it has been discussed, so it'll be nothing new. I'll talk about telehealth opportunities that currently exist. Once again, things that probably have been discussed already. I will talk about the telehealth program top 10 list. That's my personal top 10 list that I think are important items for anyone that is considering implementing a telehealth program in the environment, or if you have one in place already and you're having some challenges and maybe have some pain points that you need to try to find ways to overcome. At the end, I'll have some closing thoughts, and then at the very end, I'll open up for questions and discussions. What I found in previous speaking engagements, what I end up finding is when we have open dialogue, we have some organic conversations, and sometimes questions that you all may be thinking or maybe wanting to ask opens up and kind of takes the conversation in another direction that may not fit into a standard presentation. So let's move on. So my background originates from the IT world. I started off as a desktop technician and worked my way up through the ranks as a system administrator, data center engineer, yada, yada, yada. And then eventually managed projects and provided various levels of support. I was fortunate enough to work in a number of different industries, federal government, small business, nonprofit, academia, and then by chance I ended up in healthcare. Been in the healthcare environment for the last 11 years. Was fortunate enough to work in a hospital environment that also did a lot of work in the community and health centers and also in the ambulatory outpatient world. So in my role as the program manager of our virtual care program, I not only work with a lot of stakeholders and decision makers within our organization, but because of the way our hospital is structured, I also developed a lot of partnerships and relationships with folks in the community that our hospital had to partner with in order to provide that continuity of care when a patient left our setting and went back out into the environment, the community. So one of the things that I have been able to acquire during my experience is in the healthcare world is that I have a strong IT background from being kind of a hands-on person, but at the same time I've been exposed to the clinical workflows working with providers at the bedside and being able to understand their pain points, being able to understand the challenges. We talked about in the previous presentation, trying to find admin time and trying to find ways to articulate the message, to be able to take new solutions that are disruptive to point of care providers and integrate it into their workflow and do so by minimizing the impact it has on their ability to do their job. I've had a lot of experience working with that, and that's something that I think I've been able to leverage when I work with point of care providers. I also have been very fortunate enough in my previous role to work with hospital administrators. I reported to the president of the health network prior to me leaving, and I understand the framework of what healthcare administrators are challenged with in this current landscape of trying to do more with less, trying to achieve the triple aim, trying to reduce the cost and the expense to the organization and to the entire ecosystem, but at the same time not reduce the clinical care and improve the outcomes, but at the same time doing so in a way that allows their organization to remain profitable and sustainable and impact the populations that they serve in the particular communities that make up their market. So I like to put this at the top. Every presentation about the future of healthcare must begin with the economic impact, the unsustainable growth rate, the impact on the economy. I could go on for days about it, but I'm sure you all are aware of it, and everybody, talks about this path that we're on. But as a result of that, and I think was discussed at lunch, there are a number of approaches that have been considered and are attempting to be implemented to try to control rising healthcare costs. from pay-for-performance models to value-based care method, population health strategies, shared savings plans, clinically integrated networks, ACOs. We can go on and on. Everyone's trying to find a way to make this all work in the financial model that healthcare is currently in. This is just a graphic that kind of just talks about the distribution of where the spending comes from. As you see, there's a number of different areas that account for, all the different expenditures in healthcare. So, healthcare decision makers are reviewing all the aspects of their organization, from IT resource investments to various procurement and supply chain initiatives, to improve training and efficiency, to retaining of employees, anything that they can do to minimize the cost and expense to run an organization. And then while they're doing that, they're trying to also meet the growing and demanding patient care needs in this new landscape, in this new Uber world of patient care, where patients want to be seen as expeditiously as possible and will show up in your emergency room for a little cut that they may have got when their child was riding their bike that probably could have waited until Monday. They come in on a Saturday afternoon. And as we all know, the most expensive care that you receive in the continuum of care is in the hospital setting. So we want to try to find ways to proactively find solutions to care for patients as far away from the hospital as possible. And I know we've all heard of earlier today that, finding solutions for home-based care, using the wearable technology, smartphones, various internet-based technologies, is ideally the way to go, but there are challenges with that, and we are aware of that. So disruptive technologies can change the healthcare business model and make healthcare more affordable. We've been discussing that today, and everyone that has spoken before has kind of touched on it to some level. Jason Wang wrote a publication in 2007 that talked about the impact of disruptive technologies and how it impacts not only the healthcare industry, but also how these disruptive technologies have been applied successfully in other industries before healthcare and have been successful, and that the disruptive technologies, when they're introduced into a particular industry, they all tend to follow the same type of model and path as how they get introduced and how they effectively become the new norm. So this right here is a testimonial from a palliative care provider from an experience that we had. Video conferencing helps a long-distance family feel that they are truly a part of the local family. It allows us to show families important visuals they need to make difficult decisions, and allows families the ability to tie up loose ends prior to a patient's passing. I show this because one of the benefits that our virtual care program was able to provide was not something that was on anyone's radar when we started to implement these solutions. The palliative care piece just kind of happened by chance. We had a few patients who Holy Cross serves a very diverse market outside the DC area, so you have a lot of international patients with families that may be dispersed around the country or around the world. We had a family situation where a male who was the father of, I believe it was 7 children that were spread out in Europe and Africa and some here locally, were struggling with end-of-life decision making. And because the 2 local children were here every day, they were very connected and close to the condition that the parent was in. The others were remote. They did not understand the brevity, so when the discussions of how to handle the situation, how to care for the parent came up, they were not at a place where they were willing to make some of the difficult decisions. I set up a basic virtual connection to allow them to connect from where they were, whatever device they were at, from their respective remote locations, and we did a virtual live consult The palliative care staff went into the ICU and they were able to take the cart in there and show the family connected remotely what it was like for their parent to go through just a simple process of being turned over from one side to the other on the bed, have their dressings replaced, and just basic fundamental care, the excruciating pain that this individual was in and how difficult it was. It only took a few minutes before you could hear the sobbing on the other end for them to realize the dire situation that their loved one was in. And at that point, up until that point, none of the conversations that needed to take place could happen. But once that interaction happened and they were able to see it, it changed the whole care process from that point on. So I wanted to share that with you because we had a lot of success. We had a number of events and episodes in the palliative care environment where we were able to connect families with their dying loved one and allows them to either grieve together, pray together, or be a part of that process. And it ended up being something that was very significant and valuable to those going back to the patient care experience. Those families that were a part of that experience were very appreciative and it really resonated well with them. So, obviously we've been talking about technologies, disruptive technologies, and all the various solutions. We've seen the gamut of all the different tools. This is just an extension of that to talk about some of the current technologies. You know, you have Instagram, and you can see their value, and they have 13 employees. And you have Netflix with 2,000 employees, Apple, 92,000 employees. And the statement here is technology is changing the face of business. It's changing the face of business in every industry, not just healthcare. We that are in healthcare are struggling to figure out how to leverage these technologies in the environments that we're in, with all the barriers, with all the challenges, with all the education and all the things that it takes for us to leverage the benefits and the advancements of today's technology and be able to put it in a clinical environment and improve patient care, improve patient outcomes, reduce costs. So we have a lot of opportunities for telehealth. As we said, disruptive technologies must be matched with innovative business models. Coupling technological advances with appropriately matched business models is the right prescription for our ailing health system. I will give you an observation that I made at the ATA. How many of y'all were at ATA this year? I know Joe was. No one else? Okay. Are you all familiar with ATA? Is anyone not familiar? Okay. So I went to ATA in Los Angeles, and my colleagues that were there, after about 2 or 3 days, everyone was going off in their different directions. They met with the various vendors, they went to different sessions, got the experience of it, and there was, some scuttlebutt as far as, hey, what do you think about this year's ATA? And it was a common theme that everyone said, hey, not too much to see here, no wow factor, no innovation, no new technologies, no new solutions. And so my response when I heard that was, wow, that's interesting. And then I thought about it a little bit more. Well, we've already discussed in the previous presentations all the new technology that's out and all the amazing technology that that's already available right now today, and then obviously the future technologies. But one of the things that people have yet to kind of wrap their head around is we don't need more gadgets and widgets and more apps and more services. What we need to do is develop the innovative mindsets and creativity in how we leverage what's already in place and adapt it into our environments and actually transform the way we do business in the industries that those technologies can be applied. So in the healthcare world, we need to find ways to leverage what's already out there to improve patient care. So with that, I went through a lot of the content that you will see here is stuff that I have researched long before I knew I was going to be here and speak to you all today. I'm on social media. I peruse different websites that talk about telehealth. I read different business case studies. I'm currently a graduate student here at University of Maryland, so I have to write papers, to complete my graduation requirements and get my credits. So some of the papers that I've written, I've done a lot of research on telehealth and mobile health and healthcare delivery models and challenges and things like that. So I found, as I was preparing for this presentation, I went back through, I saw, I think you were taking pictures earlier. I attend a lot of conferences and I take pictures and presentations when I see someone present something that I think is really significant or it resonates with me. And I remember, I believe it was HIMSS, one of the presenters, put this on his slide. And I thought it was very, provocative. And I thought it was also appropriate. But I did not know it was going to be appropriate to my conversation today until I started going through my camera roll on my phone and I realized, look what I have here. So the biggest innovation in healthcare, it's not technology, people talking with and listening to each other. And it speaks to the point that I just made, is that we don't need more technology. We need more creative thinking of how to use the technologies that already exist and apply them in the business world and be able to impact change and improve the way we do things. So I like to say all the time, we have to work smarter, not harder. The technology is out there. We have increased bandwidth now. I remember when the story of the Marine that I shared with you earlier, the reason I point out when it was done is because at that point in time in the summer of 2011, there was only one company that offered cloud-based video conferencing technology that you could use where the bandwidth requirements was small enough to be broadcast over a wireless connection. All the other video conference technologies up to date at that point had to be landline connected. And so that was an innovative approach. We didn't think we could pull it off because it was so new, but we actually did. And so those are the things when we talk about technology, not only being innovative and early adopters, but then also finding out how you can leverage it in your environment and actually produce some outcomes that are favorable. So, Pew Research Center 2014, it talks about text messaging, voice, video calls, internet, and the percentage of smartphone users that use these particular services on their phones, and the average number of survey respondents over a 1 week period. So this is just kind of showing how people use their smartphones and just kind of figuring it out that you have text messaging, video, voice calls, internet, email, and social networking are like the top 5 items. So how can we leverage those behaviors? We talked about earlier, was mentioned, trying to leverage behaviors that people are using, or technologies and solutions that people are already using as part of their consumer lifestyle and the way they socially interact with their peers. So with that, the patient telehealth survey from South by Southwest Health Tech Trends says 70% of patients are comfortable communicating with their healthcare providers via text messaging, email, or video instead of seeing them in person. So this goes to this kind of Uberization of, I want convenience. I want to be able to see my providers when I need to see my providers. The consumerism of healthcare is really starting to take root, and it's causing healthcare providers to seriously have to look at the way that they do business to meet consumer demand. Towers-Watson analysis, it talks about employers are using telehealth solutions to offer more convenient care options to employees. I think that was also mentioned in our discussion earlier at lunch, that employees or employers are finding that offering telehealth solutions to their employees is a big winner for them. It's a big winner for their employees. The employees will consult with their doctors online or over the phone, or using their smartphones. They'll do, as we talked about, they may, if they're offered a text messaging or video consultation solution, They'll look at those options to interact with their provider. From the employer's perspective, beyond the cost savings, improved employee productivity and reduced absenteeism is very beneficial to them. So the estimates that Towers Watson came up, $6 billion in potential savings from optimal use of telehealth solutions. 22% large U.S. employers currently offering telehealth to employees. 37% employers expected to offer telehealth solutions by the end of this year. So we can already see that employers are changing their approach into what they're going to offer their employees to try to help them maintain their health. So this next part is my tribute to Dave Letterman and him signing off. It's not going to be as entertaining and humorous, but I at least thought I would honor him today. So my top 10 list, the first 5 items, or the bottom 5, will focus on my experiences as now being a vendor trying to provide solutions to healthcare providers, what I've seen and what I think from a customer's perspective or provider's perspective, things that you should be aware of to help your vendors do a better job in partnering with you. And then the top 5 will be the items from my experience from when I was on the healthcare provider side and the things that I saw and experienced when trying to implement my virtual care program and some of the successes and challenges I had there. So are we ready?
Ready.
All right. How to ensure your telehealth program will be a success. Number 10, requirements. Requirements. Get the correct resources involved with the appropriate skills to identify the technology, solution needs, and requirements. This is very important. The reason this is important is because many vendors, they can sell you technology, they can sell you whatever it is they have, and they'll try to sell you whatever it is that you appear that you need. But you need to have people within your organization to have the appropriate skill sets to articulate your requirements, articulate your needs, and be able to differentiate things and features that you don't need. Because the vendors, while they will sell you solutions, ultimately they want the solutions that they sell you to be successful and actually have value to you when they come in your environment. So the requirements include end user, technical, legal, and any operational requirements and processes to introduce a new technology solution into your organization. I know John mentioned, when he has a new technology solution, it has to go through his IT department and through their security and risk assessment. There's probably legal folks that need to be involved. There may be an approval process from executive management. There may even be other downstream support devices, your procurement, supply chain folks. There's a number of other things, folks in terms of shipping, who receives your stuff, storage. There's a number of things that most people don't think of when they're looking at new technologies, and then they go down this path and they find a hiccup somewhere along the road because they did not do their due diligence or they don't fully understand their operational procedures within their organization. So making sure you get the right people involved and really understand the requirements, not only from your organizational requirements, but also the vendor requirements. A lot of times the vendor needs to know the requirements in order to make sure that they provide you the right solution or the right tool to meet your needs. The system was never broken, it was built this way. That's one of the ones that I got from a presentation that spoke to this point about the importance of making sure you obtain the requirements up front. Because when it doesn't work, the customer blames the vendor. The vendor then says, well, this is what you told me. I did what you told me. I sold you what you asked for. So in order to avoid that, it's important to do the due diligence up front, ask the right questions, get the right people involved. Number 9, organizational procedures. I think I just mentioned in my requirements that there's certain parts of your organization that you may not be aware of that need to be involved when it comes to vetting a new solution. I know that in my experience, just with some of the providers that we're currently working with now at Ironbow, different organizations have different processes for introducing a new vendor into their environment. They require different approvals, different types of documentation that needs to be provided, whatever it is. That process in itself, depending on what may be going on within your organization, could be weeks, could be months, who knows. So if you don't get that process started soon, you're not aware of it, you may have in your mind, I have a solution that I now want to implement, I want to get it done by the end of the month. Well, your internal processes may not even allow you to get the first part of your project started within a month. So understanding that is very important. Include your IT services early in the process. John and I have a long history of talking about our challenges with our IT brethren in our organizations. The reality of it is there's a lot of disconnect there, and a lot of it has to do with communication. A lot of it also has to do with understanding. And I think earlier was mentioned, there are a lot of stakeholders within a healthcare organization that don't really understand the benefit or the value of telehealth. And trust me, I think we talked about in one of my comments that IT folks manage things from an enterprise perspective. They want to use the same solution and replicate it across an entire organization in a cookie cutter approach. That's the way they're taught, that's the way they're trained, that's the way they're experienced. They don't understand how to focus on clinical outcomes and clinical needs, and they don't always do a good job when it comes to patient care experience, don't always understand the needs of the providers at the bedside. So a lot of times they're just uneducated. You or someone that's in the particular position have to do a good job of getting them involved early in the process and explaining and answering whatever questions they may have to make it go smoother for your implementation. Do not forget to get the buy-in from your executives, your department heads, your medical directors, your legal finance training, etc. Clinical targets. Define what clinical data that can be used for measuring the impact of the program. So this is basically how are we going to define success. Once we have a new solution that's implemented, how are we going to determine that we've actually had the desired impact when we set out to go down this road? This is something that can be difficult to achieve if not everyone is on the same page in terms of what defines success. Allow enough time to gather enough meaningful data to ensure success. Well, the reason that I say that is because you may implement a solution, you may give yourself a 90-day pilot because that's maybe what the resource allocation can only cover or the funding can only cover. But then somewhere along the line, you may not have enough clients that actually are exposed to this particular solution, and you don't have enough use cases and data to be able to make an accurate assessment. Some organizations may scrap a completely successful pilot project because they just don't have enough insight or data to really justify the continued investment in the solution, and they pull the plug too soon. So you want to make sure that you have enough data to be able to analyze and accurately assess the impact. And obviously for a program that you want to sustain over time, you want to be able to determine the long-term effects of when the solution was implemented, and then over a period of time what the impact is or was that the solution had once it was introduced to the environment, and then be able to drill down on specific use cases or different specialty areas or disciplines. Do not consider technology solutions from vendors that do not offer data performance analytics and reporting tools. In this day and age where we're all focusing on value-based performance, if a technology vendor is not able to provide you the type of metrics, data, and performance data that you need in order to make the assessments, then you should not consider them. Every vendor out there now understands the current world that the healthcare industry is in, and having to justify and be able to easily demonstrate return on investment. So we want to make sure that if they don't have it, you demand it, and if they can't provide it, then you may need to look for another solution. Number 7, resources and projects. This goes back to coordinating with other departments and leadership to make sure you have the appropriate resource availability for the implementation phase of your program. It also talks about, when you talk about the admin, every department, every employee has a certain amount of hours that they have to get their normal job done. And then you add another project that adds on top of their full workday. Then the next project adds even more. So now, in order to accommodate your needs, they have to work 2 hours extra on top of all the other things. Those don't go over very well. So it's very important to make sure that you coordinate resource availability when you're depending on resources from other areas of your organization. Obtain an agreement on expected roles and responsibilities of resources post-implementation. This is also important because after you have your successful implementation, you want to be able to articulate to those staff members that are going to be part of your solution what the expectations and what the impact is going to have on their daily routine going forward in order to support your solution. Educate and train all the necessary resources to support and manage the program on an ongoing basis. So education and training, and this goes on after, because every time there's a new employee that is introduced to this solution, you're going to need to make sure that they know how to use it. Anytime there's employee turnover, the next person that may come in and backfill, they need to be brought up to speed. So you need to have the resources to have a continuous education and training program. Expectations. Establish a partnership and a trust with all stakeholders, internal, external, and vendors. Provide feedback to all stakeholders, especially vendors, as each environment has a uniqueness in using a particular technology solution. Aid and protect your vendors from organizational processes and politics as much as possible. I can't emphasize that enough. A lot of times, there's dysfunction or disconnect within organizations, and depending on who may be the champion or the person involved with working with a particular vendor, they may insert them into the middle of a situation and expect the vendor to solve a problem that's an issue within their organization that has been there long before that vendor was brought into the environment. You don't really want to do that because ultimately it puts everyone in an uncompromising position, and it's definitely a recipe for failure. The last one, be realistic with program expectations and timeline. Achieve small wins. One of the things that I've seen in the short amount of time that I've been on the vendor side in healthcare is that the healthcare providers, when they work with vendors, they expect the world. And a lot of the expectations can be unrealistic in the short term and the long term. And so you need to be realistic with your expectations. So this is kind of my illustration of expectations. I don't know if you all have seen this, but you get to pick two. Pick which two you want. So, once again, this is one that I borrowed. But I thought it illustrated the point about expectations. Because, just the one on the bottom, cheap and fast won't be good. Most people want cheap and fast, but they expect good. And so I just thought that this was a good way to illustrate expectations and being able to manage expectations and not expect your vendor to be a savior to solve problems within your organizations that are really unrealistic. All right, number 5, fear. Fear is one that I love because everyone has it, and I think we also talked about it. Do not fear the boogeyman, aka HIPAA. Every time I talk to someone about telehealth, at least not so much in the last year or so, but the first couple of years, everyone talked about HIPAA. It was either HIPAA or reimbursement. I can't get paid or it's not HIPAA certified. Well, we had that discussion, John talked about it earlier. You can't let this be a barrier. You can't be afraid of it. You have to, the landscape in healthcare is changing. You still have to care for your patients. You still have to provide services. You're still on the hook for that. You have to find efficient ways to do it. You have to find improved processes, improved approaches. Innovation is out there that can help you do it better, do it smarter, do it a little bit more efficiently. You have to do your due diligence, go through the appropriate coordination of resources and operational processes. Most organizations have processes in place to make sure that you're in compliance, but don't be afraid to go down that path. Don't be afraid of the boogeyman. And don't be afraid to make mistakes and learn as you go. Telehealth is new for everyone. It's new for the vendors. It's new for the healthcare providers. Even though someone like John, who has a lot of experience in his environment with telehealth, every time he introduces a telehealth solution to an area of his organization that does not have telehealth, he's going down a new path. And he doesn't know all the things that may come up in that process. So we can't be afraid to make mistakes, because there are a lot of applications of telehealth that can be used, and we're going to always be constantly learning on different ways and different methods on how to introduce and to try to improve patient care. So this is another illustration. Doubt kills more dreams than failure ever will. So this goes kind of hand in hand with the fear thing, Fear, doubt, don't believe that something will work because you're afraid to try. Commitment, I believe someone mentioned that a little while ago. Commitment, this is one of the ones that I think is very important. Once you decide to implement a telehealth program, you have to commit to it. When I mean you, whoever the champion is, whoever the leader is, you have to commit to it, and you have, if it's more than one person, you have to commit. After you commit, you have to make sure you get the commitment from the dependent resources that are required to ensure the program's success and to obtain the user adoption that you're going to need in order for you to get the end result. If your end users or the stakeholders in your organization sense a lack of commitment to the solution, they will not buy in. Your project, your effort will be pretty much dead on arrival. You have to get the commitment up front from everybody on board. If you do not, you might as well stop, because it's going to fail at some point along the way. So this is my new telehealth project cartoon. So this is illustrating the commitment. We need to make sure we're committed. And what I mean by commitment, we need the organizational commitment, but we also need a commitment of the resources that are required in order to get the job done, to give it a chance to succeed. Leadership. You need to identify an emergent leader to oversee and advocate for the program. That leader could be one person, or it could be a combination of people. The reason I say leader, in the healthcare environment, you may have to seek out a healthcare administrator, a clinical leader, maybe a technical leader, or a power user or super user. It may be multiple people, but it may be an ambulatory practice or a primary care practice or a specialty practice health center. That person, it may be one person that has to be that emergent leader for your organization. The emergent leader needs to inspire and motivate end users to see the desired outcome for patient care and work collectively to achieve. Must have the qualities and characteristics to influence and affect organizational and culture change. Not everyone is cut out to be the leader that is necessary to try to knock down barriers and change culture within an organization. But in order for your effort, your program, your solution to have success, you need someone that is representing and advocating it and is able to articulate the benefits and the value of the program to the appropriate stakeholders within your organization. Marketing. We've heard that a few times before today. Marketing, as you see, is number 2 on my list. It's pretty high up there. We had a lot of success in my hospital and with our virtual care program. But the stories that I shared with you earlier, not too many people knew that those even happened in our hospital, because there was a disconnect between the various resources within our organization and the marketing folks. So therefore, if they found out about those experiences and those stories, those patient stories through word of mouth, that was great, but it shouldn't have taken that. There should have been a marketing campaign. There should have been something that told everyone what a significant moment those experiences were and how we could replicate that experience and scale it across the entire organization. So you want to partner with your marketing department to communicate program plans and benefits up front so that they know that you're going down this path, and so that way they can appropriately plan their resources to help support your effort. Communicate to all areas and levels of staff throughout the organization and externally. Not only do you need to communicate and craft a message internally, but you need to have a message that's crafted specifically for external stakeholders and those that may be interested or may be impacted by your program. And what I mean by that, the message for your patient population would be different than your staff internally. Your message to your community partnerships, your health centers, your skilled nursing facilities, your primary care practices, you want to let them know that you're doing it too, so that they'll want to partner with your organization. Use social media and creative campaigns to get the word out. You could do contests, you could do giveaways, videos, whatever ways that you can use to get the message out. In today's world, using social media is a cost-effective way, and if used in the proper context, can be very effective and not actually require a lot of resource or cost to do it. So how do you ensure your telehealth program will be a success? Number one, are we ready? Drum roll. Nurses. Your program will fail if your nurses are not involved. Your nurses are pretty much the ones that are at the bedside. They're the ones when the doctor needs to do a virtual consult with the patient or another provider. They're probably going to be the ones that push that cart or initiate that session. If they don't know how to use it, they're not going to use it, and it'll get pushed in the corner. They are no doubt the most important person or persons that play a role in the effective use of your telehealth program. Their impact, their input, and their feedback is vital to the program's success. If they tell you that there's something about the solution that's not working for them, you have to listen and you have to try to fix it. Because there's, in every healthcare organization, there's more nurses than there are anybody else. You have full-time, you have part-time, you have day shift, you have night shift. There's a lot of transition throughout the course of a day. A lot of different people that come in contact with this solution. So there's a lot of people that have to be up to speed, feel comfortable with the solution. It has to be simple, and it has to be effective, and it has to work when they use it. Otherwise, if it's perceived as unreliable or too bulky or too cumbersome, or it's not productive, it doesn't help me, you're going to have a difficult time overcoming those. The marketing and communication plans, going back to marketing, need to include all shifts and part-time staff. So once you market this throughout your organization, do not forget your evening shifts. Do not forget your weekend shifts. Do not forget your part-time nurses that may only show up once every 3 or 4 weeks. Because they are the ones that it just might be their night when there is an on-call situation where someone needs to receive TPA in the stroke environment in the ED, and they just don't happen to know where the card is, where to find it, or how to use it. So this is another testimonial. The virtual care's use of Meeting Place turned out better than I ever expected, and I know my mother was eternally grateful for being able to see the wedding, as am I. I can never thank your team enough for such a wonderful job and experience. And this is from the daughter of an oncology patient. So the story behind this one, there was an oncology patient who had stage 4 cancer and was deteriorating badly. Her daughter was set to get married, but because of her mother's declining position, she had to reschedule and move up her wedding date. The week that she was scheduled to be married, they were getting married in Baltimore, Maryland. It was end of July. I'm not sure if you all were here, but there was a period where we had like 3 to 4 100-degree days, high humidity days in a row. There was no way she could safely travel from Silver Spring, Maryland to Baltimore in that extreme heat and not compromise her health. So they asked us if there was any way we could broadcast the wedding. I went out to the church where the wedding ceremony took place, had my laptop, my camera, my MiFi. My doctor was and the nursing staff was in the patient's room. We were able to successfully transmit the entire wedding ceremony for that patient and their family on that day. And they were eternally grateful. And this was an excerpt of the note she wrote me and the other staff. So here's some lessons in closing from other industries. Dr. Sanders and some of the other speakers talked about change and the resistance to change and trying to implement solutions in environments. Well, here's the lovely business case of Kodak versus Instagram. Kodak's dramatic fall that led to their bankruptcy could have been prevented. When new technologies come out and change the world, some companies are caught off guard. They don't know how to handle it. They don't know what to do with that information. They see change coming, but they're unable to adapt to the change. Either their processes internally or their leadership, whatever it is, does not allow them to adapt and become nimble. And then the companies like Kodak basically saw their future and simply could not figure out what to do. So I close with a famous quote from Albert Einstein: "We cannot solve our own problems if we use the same thinking we used when we created them." If you have any questions, thank you all very much.
Albert, when you were at ATA, did you see any particular technologies that were emerging? We have a big issue, and we were talking earlier today about prevention, fall prevention. So there's this big initiative to try to eliminate sitters that are required to watch patients, and either they're not responsive, they fall asleep, and now there's this, hey, let's look at a telemedicine solution that we could ultimately put in here and have a nurse be able to watch 8 rooms at the same time rather than hiring 8 different sitters. Do you see anything at ATA, or I guess being at Ironbow, have you seen any of that technology or need for anything?
Well, I mean, I think the technology exists to design a solution like that, but then are we talking about a mobile solution or a fixed endpoint solution that you're going to mount a camera in a room, an examination room? I think you could put the components together. In Holy Cross, we had a falls assessment process where we had one of our providers, when there was a suspected falls candidate, could basically do a virtual consult with our Senior Source Community Center and be able to do a remote over the video conference so that resource didn't have to leave the facility and go and do it in person. So I think it can be done. They were able to put tape lines on the floor so the patient would know where to put their feet and kind of where to position so the remote person could see them and be able to be in clear view. So I think it's just a matter of working out the form factor and kind of the process and protocols in place, and then obviously making sure you coordinate the resources. Now, if someone is falling asleep or not attentive, I don't know if there's a telehealth solution that's going to fix that one. Maybe there's one of those pills that you can swallow and it zaps them on the inside and wakes them up. But I think that's just a matter of trying the different options that are out there, seeing what may work in that.
Well, they're basically trying to pull those sitters out and ultimately replace them with just a solution.
A video endpoint of some sort.
Yeah.
Yeah, I don't know You know, I mean, I'm sure there's technologies. I did not see anything at
Okay.
ATA specifically that might accommodate that need. The one technology that I would say that I think it caught my attention, but I wasn't able to talk to them enough. There was a company out there that was actually kind of a mobile app aggregator, where they were basically a kind of a hub, if you will, for all of the various smartphone apps, healthcare apps that are out there, to be able to take the data and kind of capture it and then convert it and translate it so that it could go to the various EMR systems and things like that. Now, I didn't do enough digging to find out how effective it was, but that was the one that kind of caught my attention.
Isn't Joshua's company somewhere that's yours?
Well, yeah, I mean, we don't aggregate apps. I mean, it's
No, I meant the
yeah, I mean, we use a smartphone to measure balance and quantify falls risk, and then provide a sort of treatment plan. I mean, what you're talking about, I mean, not to go off on a complete tangent, but I don't think I'm sort of with watching them. You know, there are these alarms that people put into beds, right? If they get out of the bed or out of the chair, then it's that signal alarm. But that's very well proven not to reduce falls. So what it's useful for is in allocating resources for staffing. And so you might save money on nursing staffing that way, but it doesn't actually prevent falls.
Right.
For what it's worth.
Yeah.
Any other questions? I guess that means I did a good job.
Yes, you did.
Or you heard it 6 times already today, right? Thank you all very much. I appreciate it.
All right, great job. Thank you.